Beverly Hills, land of the rich, home of the famous. Sure, the stereotypes exist, but what most people don't know is the truth behind the plastic. If there is anything I have learned in all my years as a plastic surgeon, it's that appearances are not always as they seem. I get patients from all over the world, from celebrities to the average everyday housewife. But there is one thing they all have in common. Everyone needs a lift. Welcome to my world.
Dr. Kassabian has totally surpassed my expectations. He has his own surgical center and team of nurses that took care of my every need.
I can't believe the impact this has had on my life already. I think mentally and emotionally, I'm just so much more confident and secure in my appearance.
I can't believe I've waited so long to do this. I finally feel like me. No more dark circles, and I feel like this is the nose that I should have been born with. I absolutely love it.
I feel like a new woman, and this is a gift for life, for my new life.
It's been amazing. I can't believe how quickly I healed, and I feel like we picked just the perfect size. I've never felt better. Thank you, LiftMD Aesthetics.
My name is Inga, I'm 20 years old and I'm a sophomore at Cal State University Northridge. I'm a graphic design major and my life and career goal is to be a graphic designer, doing logos, ads, billboards, magazines, anything that involves the skills that I learned in school. When I was younger, I broke my nose playing basketball and it affected the way it looks, my whole facial structure, my expression. My nose has become crooked. It also affected my breathing. And I've been thinking about the surgery ever since it happened, which is a while now. Now that it's summer vacation and I'm done with school, I think it's a great time to do it. My sister has been one of my best friends and she's always been a big support for me.
Yeah, I have been there for Inga ever since she broke her nose, and when she decided to do the surgery, I have been there supporting her, so I think it's a great idea that she wants to do it because she's been thinking about it for a while now. And so I think it'll be a good change in her life, you know, it'll be positive, and she'll be a newer, better version of herself. So I'm excited about it. Can't wait for the outcome.
Today I'm meeting with Inga, who's a first-time patient. She's interested in a rhinoplasty and a chin augmentation. I'm looking forward to meeting her and hearing her story. Hi, I'm Dr. Kassabian.
Hi doctor, how are you?
Good, welcome.
Thank you.
What brings you in today?
I'm here to talk about a rhinoplasty and a chin implant.
All right, I see you've done your homework.
Yeah, I have. I give it a lot of thought and research.
Fantastic. And what's bothering you about your nose?
Well, I broke it, I got hit with the basketball, and ever since then my septum has been deviated, and throughout the years it's gotten bigger, and my left side I'm having trouble breathing because of it. And also my face, I've gotten dark circles under my eyes throughout the years as my nose has been changing.
I'm sorry you had the accident. How old were you when you had
I was
the basketball
13
injury?
years old.
Okay. And difficulty breathing is from the which side?
For my left side.
Left side. Okay. You were mentioning also your chin. What's the issue with that?
Well, I found out that a lot of rhinoplasty patients also do it because it gives the nose a better look after the surgery. It gives the face proportion. And I looked at pictures, I read about some patients doing it, and I liked the results and I liked how their thoughts on it. So I decided to give it a try and do it.
Yeah. Well, it's obvious you have a deviated nose, a crooked nose from the injury. It appears that you have a deviated septum. So I'm going to take a look from the inside, examine your septum and turbinates. And as far as the chin is concerned, you're right. A lot of patients who get rhinoplasty, that's a common concern and a common procedure where I augment the chin because helps bring the nose into proportion because the face is divided into three portions, 1/3, 1/3, 1/3, and you need to bring them into balance. So when this lower third is weak, when the chin is weak, as much as you make the nose smaller, it's still gonna look big because it's not in balance. When you augment the chin area, when you make this stronger, then the whole silhouette, the profile is going to look so much better. Okay, and as far as the dark circles under the eyes, I think because in this area you're skinny, you don't have a lot of padding, you start seeing the skin on top of the bone and the blood vessels. So it's important to add some padding in this area. I think some fat injection in that area would be excellent. Alright, so next we'll take some photos and I'll do the morphing on the lift tuck app. I'll show you with the nose straighter and also with the bump gone and also with the chin augmentation. Now also I'm going to examine you from the inside. What's the condition of the septum and the turbinates and make a decision.
Okay.
Alright?
Okay.
Breathe in. Breathe in. Okay, chin up a little. Gonna bring the bump down and then make this less projected. Okay, and add a little bit of the chin. See, adding the chin by itself, a little bit of chin, and then shave the bump. I just got done meeting with Inga. She has a severe septal deviation to the left, which is blocking her airway on that side. And at the same time, she has a big turbinate, that's the filter on the right side, that's also compromising the airway on the right side. So she's gonna need a septoplasty to correct the septal deviation, as well as make the turbinate smaller to open up her air passages. Her other concern is that she has a weak chin. She will need a chin augmentation with an implant. This will bring the proper proportions back to her face. With a prominent nose and a weak chin, however small you make the nose, still it's gonna look big because of the weak chin. With an implant in place, those proportions will be better, and overall these two surgeries combined, the rhinoplasty and chin augmentation, will give Inga the look she wants.
Considering plastic surgery? Want to see results now? Introducing Lift Tuck app by Dr. Garo Kassabian for your iPhone and iPad. Snap your photo on your phone or upload one from your library. Choose the area you want to change and change your look with the swipe of a finger. Share with friends. Email for a consultation. Get health and beauty tips. Shop for beauty products. Enjoy the new you, because looking good feels good.
Do you need a lift? Do you have a story to tell? If you're interested in being part of a new hit series, Dr. Lift, or maybe just need a one-on-one with Beverly Hills cosmetic surgeon Dr. Garo Kassabian, now's the time. Whether you're a mommy in need of a mommy makeover or simply not satisfied with your appearance and ready to do something about it, we want to hear from you. Email us at casting@liftmd.com and give us your story. You could be the next patient on Dr. Lift, because looking good feels good.
Today is the day of my surgery, and I'm happy that it's finally here, and I'm excited to see the results, and I can't wait.
Good morning, Inga.
Good morning.
How are you?
Good, thanks.
Good,
How are
good.
you?
Are you ready for the surgery?
Yeah, I'm ready. I'm excited.
Okay, fantastic. Any last minute questions?
No, I'm just excited to see the results and can't wait.
Okay, fantastic. So what we're gonna do is the rhinoplasty, shave the hump, make the tip finer, less projected, and a small chin implant to match it. All right?
Okay.
It's gonna come out very nice.
Okay.
Okay, give me a hug and let's start.
Thank you.
Today's Inga's surgery. She's got a deviated septum, so I'm gonna correct that and make her breathing better. At the same time, I'm gonna give her a cuter nose, shave the hump, make the tip a little bit finer and less wide. And she has a weak chin, so she's gonna put in a small chin implant so that everything's proportional. And I'm very excited to see the result. So just got done with Inga's chin implant. Already things are looking better. Her face is in better proportions with a more powerful chin. Her nose is going to look smaller, and overall it will give a more beautiful effect. So next I'm going to be doing the Septoplasty and the Rhinoplasty. Just got done with Inga's surgeries. She had a severe deviation of the septum to the left side, so I corrected that towards the middle. And also she had big turbinates, those I shrunk them down. So now she'll be able to breathe a lot better. Also, cosmetic part, shaved the hump, made the tip less wide, and also the dorsum here less wide. So overall, she's gonna have a cuter nose. And then with the addition of the chin implant, that just brings the right proportions to her face, and she's gonna have a beautiful result. I'm very excited to see how she's gonna look in a week.
Dr. Kassabian has totally surpassed my expectations. He has his own surgical center and team of nurses that took care of my every need.
I can't believe the impact this has had on my life already. I think mentally and emotionally, I'm just so much more confident and secure in my appearance.
I can't believe I've waited so long to do this. I finally feel like me. No more dark circles, and I feel like this is the nose that I should have been born with. I absolutely love it.
I feel like a new woman, and this is a gift for life, for my new life.
It's been amazing. I can't believe how quickly I healed, and I feel like we picked just the perfect size. I've never felt better. Thank you, LiftMD Aesthetics.
Do you need a lift? Do you have a story to tell? If you are interested in being a patient on the new hit series, Dr. Lift, or want a consultation with Beverly Hills cosmetic surgeon, Dr. Garo Kassabian, now is the time. Guys, if you are someone who is working out every day but can't seem to get rid of the excess fat deposits in your neck, chest, abdomen, or waist, then this is for you. Email us at casting@liftmd.com and give us your story. You can be the next patient on Dr. Lift, because looking good feels good.
It's been 6 weeks since my surgery, and I'm meeting with Dr. Kassabian today. I feel great after surgery. Everything went well. My healing process went fast. No swelling, no bruising. After 6 weeks, everything just looks great. And I can't wait to tell him how happy I am.
Hi Inga.
Hi, doctor.
How are you?
Good, thanks.
Today is 6 weeks since the day of your surgery. You're doing very well, I see.
Yeah, thank you.
A lot of the swelling has come down. Okay, I like what I'm seeing. The nose has taken its nice shape. And the chin implant is a nice complement to the nose. What do you think?
I like it. I'm getting a lot of compliments lately. I think it looks great.
Fantastic.
Yeah.
So in the next few months, you can expect the swelling to be a lot less. Okay, so the nose is gonna shrink and take its shape. Okay, the tip is gonna settle down just a little bit. So that would be nice, and I'll be here to watch that progress with you. Okay, but I like what I'm seeing so far. Okay. Let me take a look at your incisions. Everything's healing fine, and the chin is the tiniest incision here that's healing very well also.
Yeah.
Do you have any further questions for me?
No questions, doctor, but I just want to say thank you for everything, and I love my nose, and I love how everything turned out, and I knew it would look great, but this is better than I ever imagined.
Fantastic. I'm glad you like it. Yeah. Just be careful not to wear heavy sunglasses, because this is the time when it's very delicate, it's healing. And also, of course, avoid getting hit on your nose at this time. So I want to take some photos of you now, and then I want to schedule you for a follow-up visit in 6 weeks. So we'll do another post-op check. I just got done meeting with Inga. Today was her 6-week follow-up. Already she's breathing better, and also the cosmetic results are looking amazing. Not only is her nose looking better and the crookedness is straightened, but also the chin augmentation brought about a good balance to her facial proportions. As we know, Inga broke her nose when she was a child. When a child has an accident at a young age, it affects their development as they get older. All the components of their nose, in this case, start developing in a crooked way. The deviated septum will be more deviated because of the fracture. The bump on the nose may become bigger, and also various cartilage components, whether it's the tip or other areas of the nose, will develop in an uneven way. So it makes sense to take care of these issues sooner than later in order not to only improve the breathing but also the cosmetic look outside.
People have been telling me how much better I look and have been looking at me differently, just complimenting my overall face and my features, everything together instead of just one thing. This has helped me a lot with my confidence. I feel like I'm more myself, more natural, and I can be myself around people and not be afraid at what they're looking at when they look at me and talk to me. I knew I was in good hands with Dr. Kassabian, but he surpassed everything. He made sure that everything went well, and I'm really happy with the results. I would definitely recommend Dr. Kassabian to my friends and family. I think he does an amazing job with everything. I think this has been the best decision I ever made, and I just can't thank Dr. Kassabian enough.